Okay, everyone. Today we're going to talk about cardiac anatomy. Whether this is your first time studying cardiac anatomy or whether it's your 50th time, you're just here for a quick review. We're going to talk about this in as simple terms as I can put it. So the heart, I like to think about in the schematic of this kind of 2x2 diagram. So the upper portions, as most people think about it, of the heart are termed the atria. And so from the patient's position, you have the right atria, which can be on our left. Then you have the left atria. And then you have a right ventricle in the lower portion, as most people think about it, and then a left ventricle. The atria and the ventricles are going to communicate and work together to help pump blood forward through the cardiac cycle. Now, deoxygenated blood is going to come back from the body to the right side of the heart versus oxygenated blood is going to come back from the lungs to the left side of the heart and then be pumped out to the systemic circuit. So let's talk a little bit about how that actually works. So you're going to have kind of two components. You're going to have actual blood vessels, or what we sometimes term great vessels, that are going to bring blood to or from these chambers of the heart and help communicate between them. And then you have valves that help actually close off portions of the heart to each other to make sure that that blood is being pumped forward. So we're going to start all the way at the beginning with deoxygenated blood. And so you have two primary blood vessels that feed into the right atrium. So one is the inferior vena cava, or IVC. And the other one is the superior vena cava, or SVC. Those are going to bring deoxygenated blood again into the heart from the body. That blood is then going to pass through a valve that will close at certain portions of the cardiac cycle that we'll talk about. And that's called the tricuspid valve. Tricuspid because it has three different cusps to it. So that deoxygenated blood is going to pass through the tricuspid valve into the right ventricle. And then what's going to happen is it's going to pass through one of our great arteries after passing through yet another valve. So this valve is going to be called the pulmonic valve. And deoxygenated blood is going to be pumped from the right ventricle into the pulmonic artery, or pulmonary artery, the PA. Put that in the right color. So your PA, pulmonary artery, pulmonary trunk is the first portion of that, if you've heard your anatomy professors talk about that. And it's going to go to the lungs through a capillary bed. And once it passes through the lungs, it's then going to enter the pulmonary veins on its way back to the left side of the heart. But at that point, that blood has now been oxygenated in the pulmonary capillary beds. It's then going to enter the left atrium from the pulmonary veins, where again, you're going to have a section that is going to then pass through a valve. This valve here is termed the mitral valve. You'll also hear people refer to it as the bicuspid valve. And so you're going to have your oxygenated blood that's going to pass through that valve. Again, your valves are just helping make sure that you keep everything moving in a one-way pattern and you don't have blood flowing backwards, which is some of the pathology we'll talk about when we talk about valvular pathologies. From the left ventricle, that oxygenated blood is then going to leave again through another valve, this time termed the aortic valve, which is going to allow blood to flow into, you guessed it, the aorta, and leave the heart and go out to the body. And what we term the beginnings of the systemic circuit, which is then going to loop all the way back. So if you have your body somewhere out here, you have oxygenated blood that's going to leave, go to the body, where it's going to become deoxygenated and then return via the SVC or the IVC. That's the basics of the cardiac anatomy and the way that blood flows through the cardiac anatomy. A couple of important structures to also point out here that we've drawn and just kind of not really talked about is going to be the atrioventricular septum, or the AV septum. So this is what separates the atria from the ventricles, except for at the areas of the valves. And then you also have here the interventricular septum. I'm just going to abbreviate that, IV You don't have to watch me spell out the whole word. But the IV septum, again, is going to help separate the two sides of the ventricles from each other. You also then have an interatrial septum, which I'm just going to write out like this. And the atrial septum is going to, again, help separate the atria. That's your basic anatomy. We'll talk in other videos about the pathology that kind of messes with the way that blood flows. We'll talk about the way that the cardiac cycle works and how the heart beats at a later time.